skipping to pacemaker.
So we're skipping 11?
Yeah.
We're gonna skip 11 and let you guys absorb what's going on.
So I'm only behind on 4.
What's that?
I'm only behind on 4 chapters then.
You're not behind on any of them. You're good. You'll be good. Are there any big glaring questions that are bothering you guys? Yes.
How many arguments does these thing cause in the back of the ambulances?
Pacemakers?
Well, no, just rhythms altogether.
Oh my god.
How many arguments?
Lots.
Lots.
Lots. Especially when we're standing in the hallway and we're bored. It's like.
That's what I thought. I'm like, after getting through these, and it's like, oh, could be this, oh, could be that, oh, this, is that key? I cannot imagine how many freaking arguments are going to be created with this.
A lot. You'll show up at a station and it'll be like, what do you think this is? And it's like, oh.
Sorry.
Okay.
Well, but they don't expect us to be
No, because typically you're not going to see a nice, perfect example of it. It's going to be some wonky rhythm, and they're going to go, "What's this?" And then they'll walk you through it. That's the beauty of preceptors, is they will walk you through everything.
But if you know those 5 questions and how to kind of slowly get you in, it's a great start.
Oh yeah, have your base knowledge ready to go. Yeah. So, artificial pacemakers. This is a device that substitutes normal pacemaker cells. This may be necessitated when a patient's inherent electrical conduction pathway fails to function sufficiently. Heart's not beating properly, they put a pacemaker in and make it work properly.
So will the pacemaker work for
We'll get to that. So, pacemaker spike is just that. It is a straight up and down spike you will see on the ECG. That's it. Patients who experience signs and symptoms related to extensive disease of the sinus node or symptomatic complete heart block are prime candidates for artificial pacing. It can be temporary or permanent. You can see you'll have a pacemaker and it'll just have a wire going inside. Or you can actually feel an implanted pacemaker. It'll be right up here, about the size of, I don't know, a big coin.
Usually have a massive scar.
Yeah, usually have a massive scar. They initiate electrical impulses in specific locations in myocardial tissues. Yes?
Did they change the rate, or is it just a constant rate for them?
Typically, it's a constant rate with pacemakers. If you have an implanted defibrillator, then it'll change depending on what's going on. You can have demand, or you can have
exercise.
You can have demand pacemakers, and you can have I forget what they're called. Hang on, we'll get to it. But yeah, there are different types of pacemakers. So, like the ones we use, they're constant, right? They're steady. The ones that are implanted, they vary. They're all fancy pants, and they are. Okay. So, temporary pacing. This is transcutaneous pacing. This is what we do through pads on the chest, pace the heart, right? Common term, external cardiac pacing. You guys don't need to worry about that too much.
So the pacing's the paramedic thing.
Yes. So transvenous is through a vein.
This makes nuts.
What's that? Yeah. So this is where you put a wire into the heart and pace it that way.
So that would just be done in a cath lab?
Oh, there you go. Asynchronous and synchronous.
There you go.
What?
So the fixed rate or the asynchronous, these are the ones that we have. Demand are the ones that, if it drops below a certain rate, it kicks in. So permanent, they're usually demand if they're permanent. Yeah. Surgically implanted generator and lead wire introduced through the heart, into the heart through a central vein. So we use these in symptomatic bradycardia and complete heart block. 3 types of permanent pacemakers: atrial pacemakers, ventricular pacemakers, and AV sequential pacemakers. Okay? So atrial ones do what?
Stimulate the atria.
Ventricular ones impulse in the ventricles, right? So when it comes to these, do you have examples?
Yep.
Okay.
Why would you just put a ventricular one instead of an atrial one?
Because if your atria are firing properly and your ventricles aren't, you can put one in to make your ventricles pump properly.
So are they gonna do like one or the other, or are they gonna put?
Usually both.
Usually
Yeah.
both. They would go with this, the AB sequential pacemaker. It all depends on what condition the heart's in. This one, you'll see two pacemaker spikes. We're gonna get to that though. So this one stimulates first the atria, then the ventricles, right? Indications for pacing. This shouldn't be in here with you guys. You don't pace, so
Disregard the whole chapter.
I would.
Done. All in favor, say aye. Aye.
Like we have assist what they have. Like,
We need to know that.
There's not much for you to assist with.
Yeah, isn't it just like pushing their few buttons with like that?
Yeah, pretty much.
But just recognize it's there.
Oh no, for us to pace.
No, I mean, as.
Yeah, for you guys to
Fine.
recognize it
scar.
and find it, and
Know what it is.
you'll see it. You'll see the pacemaker spikes on the strips as well. We're getting to that. So the rate's going to vary. It'll be regular if the pacing is fixed. Is there a P wave maybe absent or present depending on the artificial pacemaker? The PR interval is going to be dependent on the artificial pacemaker, and the QRS is usually bizarre. There have been a couple times where it's like you said, we'll get into arguments and we'll be like, what do you think this is? And it's like, oh, it's a ventricular something. And it's like, nope, those are pacer spikes. That's what's causing it. So this is a terrible example. Terrible example.
Before review. Yeah, it's right at the pew.
It's right before your P wave.
This would be what? This would
That's
be
your
your
spike.
QRS?
That's your
Or
spike.
this is your spike?
The first one is your spike, then the QRS.
This is a terrible rhythm.
They're the.
Do we have other-
The review ones, look a little, some of them look a little better. It's nature.
Okay, yeah, you know what? We'll come back to this if there aren't better ones on the practice, but right now this one's ridiculous looking. What's that?
Not just talking, Justin.
Yeah, because
Just
the
not
ones like the ones I've seen when they showed it to me, it's exactly what you said. Like it's a giant straight line.
It is, yeah. Like here, this would take me forever in real life to determine as a paced rhythm.
Really?
Yes.
So when's the
Giant
actual
straight
beat
line
and
before
when's the
it
pace?
plays.
So this would be, you stimulate the atria, and then this is the
QRS.
QRS.
With an elevated
So
ST.
spike, QRS. Like I say, in real life, it's much more obvious, honestly. Common problems associated with pacemakers: battery dies, runaway pacemakers. You guys have all seen The Simpsons where it's stuck on Hummingbird. That can happen. You know,
What do you get to fly?
no, you don't get to fly. Failure to capture. This is something, they usually make sure that you have good capture, like when it's all said and done. We'll see this a lot, failure to capture. There have been several times when I've tried to pace and I can get electrical and not mechanical. It happens. Failure of sensing devices and demand pacemakers. So demand sensing devices may fail to shut down. Heart's normal rate may compete with the rate of the demand pacemaker. Under normal circumstances, patients with artificial pacemakers will require no unique medical attention. Pacemaker failure produces a life-threatening event. When you encounter an unconscious patient, check for a small palpable mass under the skin in the upper chest. This present indicates a pacemaker in place. Dysrhythmias associated with pacemaker failure are treated the same way as any other patient. So if your pacemaker fails, what are you gonna do?
What you'd normally do.
Yeah, treat the underlying rhythm, right? The heart's gonna be change patterns.
Open up, put your
Maybe one of those
double
double
A's.
A's.
Yes,
Like,
Justin.
on that topic, like you said about battery failure stuff,
Do you know what's the average life of a pacemaker battery?
I honestly don't know. I would imagine you would go in regularly and have it changed.
Well, they might do
They told her mom
the
10
wireless
years
charging.
Oh, they told her mom 10 years for demand.
Cool. You can get like wireless charging on your cell phone.
Yeah.
So there,
They just make money plug yourself into the wall.
so these
Solar.
are pacemaker spikes.
So that's a ventricular rhythm, right?
No, that's a paced rhythm.
Oh.
You're gonna get the wide, bizarre complexes following the pacer spike.
So
This is what you're typically gonna see. A up and down motion right before,
You say both the P and the
right here. So what would this be? Yeah, dual one, right? And seriously, like in real life, you will see them clear as day blatant like this.
So do they happen with every beat? Like I thought it just happened once in a while when your heart was.
Maybe a defib.
Typically they'll go every beat because it's maintaining the patient will have bradycardia or heart block, so it'll go steady to keep it at the rate it's set to. Unless for some reason they're exercising, their anxiety goes off, and their heartbeat rate goes up normally. But typically their heart rate doesn't go up normally, right? They have to be paced.
So this guy's really fighting his pacemaker in that last trip, hey?
This one?
Yeah.
No. Why? What makes you say that?
Well, so the red things I'm interpreting as the work of the pacemaker, and
What red
then
things?
on your board.
Oh, yep.
Okay. Yeah. And then it looks like the heart's trying to VFib. No.
VFib.
Yeah.
No. You're gonna get the wide bizarre complex because that's what pace.
Oh, so ignore the other rules of how to
If
interpret
you
the
see
complex.
these spikes, ignore the other rules
Okay.
and it's a paced rhythm.
All right. That's
Oh, really?
okay.
That's it.
These review strips.
So you never get competition between the device and the actual electrical circuit of the heart?
Yeah, you will. That they talked about it, right? That's one of the complications where you'll get the heart rate competing with the pacemaker. It's just one of the complications that can arise. So this one,
But this must be a defibrillator.
what?
A defibrillator. It's
This-
an awkward word.
this is an asynchronous one, so it's only pacing when there's not the nice normal
That's what I
spikes,
want.
right? So that's when you get, it goes beat, okay, we missed a beat, spike it or pace it, and you'll get your pacer complex. Normal, oh, we missed it, paced QRS.
That's what I thought they all did. No, that makes sense.
Yeah, and no, that's what that's what the implanted ones will do. It's the transcutaneous ones that are steady. Yeah.
Okay.
And again, spike, QRS, spike, QRS. Yes, all just paced rhythms. Same thing.
Look at that last one. Oops.
Wonky, goofy rhythm.
Are they?
Robitussin.
Paced rhythm.
Yeah.
Wow, they show one example of VFib, but they have 9,000 paced examples. So does that kind of make sense to you guys?
Yeah.
As long as you have that pacemaker spike, it's a paced rhythm, and it can be classified as such.
So
It's
the
not,
answer to every one of those will just be paced rhythm.
yes,
See that spike, pace rhythm, done.
yeah,
If on a
that's it.
test, they might ask you what kind of rhythm.
Yeah,
So it
they
could be
might ask if
atrial,
it's a
ventricular.
demand, asynchronous,
Ah.
asynchronous, whether it's atrial or ventricular or an AV
There was
one.
one on the test last year, and it was just,
And they're
just a
pretty,
paced rhythm.
He had
Yeah,
me at
it's-
pace and then he lost me with all those other words.
which words?
All of them, I don't know any of them.
All those words.
Okay,
Have to go
so
read
I
my
know you
textbook.
guys are a little overwhelmed with this ECG stuff. Is there anything you wanna stop